This Focus on Health segment is brought to you by Aurora Healthcare.
Hello and welcome to Focus on Health. I'm Ted Stefaniak. Well, we're all scrubbed in. We're doing something a little different today. We're about to head into the OR. We're at the Surgery Center at Aurora Medical Center, and today we're going to be speaking with Dr. Thurmond Lanier. He's a podiatrist who specializes in surgery of the foot and ankle. Let's head into the OR. Well, we're in the OR. We're ready to go here. Thanks for taking some time with us today. I think a lot of people have heard of the term scope, whether it's for a knee or shoulder, ankle, things like that. But what exactly is that surgery?
Yeah, so an arthroscopic procedure is when we make very small incisions in a particular joint, whether it is the knee, the ankle, or a joint in the foot. We generally make 2 incisions and we put a small camera within the joint. This camera allows us to see everything that is in the joint, and we're looking at the joint through usually a large screen like this. The other incision that we make is used for other instruments that are used to take care of the pathology that is involved, and we're using different instruments such as here is called an arthrocare wand, and this can get rid of any tissue that does not need to be there. And a shaver can do the same thing as well. So when we're talking about ankle arthroscopy, it's a way to get inside of a joint using very small incisions.
Yeah, and one of your specialties, foot, ankle, specifically a joint in the ankle.
Yeah, and so basically you have 2 main joints that provide locomotion in your lower extremity. It's your ankle joint, which most people know about, and it's also the subtalar joint. Now, the ankle joint is used mostly as a hinge joint, and that just means that it moves up and down generally. And the subtalar joint moves side to side. So when you're playing something like tennis or basketball and you need lateral movement, it's your subtalar joint that allows you to do so. A lot of times patients will come into my office and say that they're having pain in their ankle, but through close examination, they're actually having pain in the subtalar joint, and it could lead to a lot of debilitating conditions.
Is it a relatively simple procedure with a scope procedure?
It is, and basically we're just making 2 to 3 small incisions and sticking that camera in there. It disrupts the soft tissue very little, and so patients are generally able to get back to walking, getting back to sporting activities very quickly compared to traditional open approaches.
Yeah, so it is a relatively quick recovery then. Is this an outpatient procedure?
It is an outpatient procedure, and what's really good about it is that depending on the pathology, the procedure itself generally only takes about 30 to 45 minutes, and so you're able to generally come to a surgery center or a hospital and you're done with the whole ordeal in about 2 or 3 hours.
Yeah. Complications, I would imagine complications are always an issue with any type of surgery.
They are, but with arthroscopy, the complications are very minimal. And the main ones that we watch out for are infection. Anytime we break open the skin envelope, there's a chance for infection, but again, it's very low. And then the other thing is that we have to watch out for any kind of soft tissue that's in the way of our portal placement, and that's mostly nerves and some tendons that go there. But again, the complications are very low in arthroscopy.
And I would imagine any type of surgery, I mean, doctors are trying to avoid the surgery, as you're talking, you don't want to get through the envelope of the skin, but I would imagine rehab is the first step before surgery.
Oh, it definitely is. And so for most lower extremity injuries, we can get you better with physical therapy or oral anti-inflammatory medications, or sometimes just immobilization and getting the soft tissues a chance just to settle down. And also before we would go through any invasive approaches, we do a lot of diagnostic imaging. So x-rays or MRI studies or CT scans to make sure we know what we're getting involved with before we do any type of surgical intervention.
Yeah, and this is tremendous that you brought us into the OR to show some of the tools of the trade. Years of training to be able to do this procedure. Tell us about some of the tools that you use here.
So first of all, I want to draw your attention that a lot of these tools are designed to go into a tight space. And so you see something like this. Before these types of tools were involved, there were larger tools, and there's no way that we could get a large tool into a small space. So it does take some skill and dedication to this training to be able to manipulate such small tools. So here we have things like graspers that are able to grab very small particles that are in the joint. We have here what's called a probe, and generally I use this in the ankle or the subtalar joint to test the cartilage to make sure that it's intact. Also here, this is called an obturator. So basically we use this to go through the portal and it enters the joint capsule to make a way that we can actually get into the joint.
Yeah, it's an amazing set of tools here that you're able to use here. And again, you don't want to go to surgery right away, but if it is needed, it's available. And again, recovery is pretty quick. And can people get back to pretty much normal living without pain?
Yes, they can. And speaking about recovery, it usually takes the incision about 10 days to heal. Generally, you're walking in about 2 weeks and back to sporting activities in 4 to 6 weeks.
Yeah. At what point do you have to decide, with the patient that surgery is an option?
Well, after we've gone through all conservative care and all diagnostic studies and the patient still is in quite a bit of pain, then we make the decision to go on to an arthroscopic intervention.
Okay, and probably the best way to begin, if you're dealing with long-term pain or sports injury, probably see your primary care provider to begin the process.
Yes, and if they do some conservative care and it's still not getting better, then they can refer you to a specialist in arthroscopy.
Okay, well, we appreciate you taking some time today and showing us all your many tools here.
All right, no problem.
Okay. Now, if you're experiencing pain in your foot or your ankle, or you've had an injury, you should get a hold of your primary care provider, or you can get a hold of Dr. Lanier at the Aurora Medical Center. He sees patients in both Oshkosh and Fond du Lac. You can get a hold of him at 303-8700. I'm Ted Stefaniak, and we'll see you next time on Focus on Health.
This Focus on Health segment has been brought to you by Aurora Healthcare.